Welcome. Let's talk about non-compliance with CPAP or patients with CPAP intolerance. Now, one of the most effective ways to ensure compliance is actually to provide the most amount of education before getting started. Tell the patient what to expect, that the fact that it takes 2 to 3 weeks to really get used to it. Sometimes even using sleep aids have been shown in some studies to help alleviate some of the anxiety, some of the discomfort, trepidation associated with putting on the CPAP mask and going to sleep. So all this stuff on the front end may help further down the road as the patient starts using CPAP. Another thing is, as we go towards home sleep testing, there are a lot of other less known sleep disorders, kind of central sleep apneas or obesity hypoventilation or even primary hypoventilation. Some of these are the disorders that don't really get picked up on home sleep testing. May need in-lab evaluation. So that's also to take note of. If they can't tolerate their CPAP, if they had a home sleep study, a consideration for an in-lab study at that point. The next thing is the sleep condition. Now, this is extremely important. If a patient slept with 3 to 4 or 2 pillows, for example, during the sleep study and the CPAP titration, and now they're using 1 or 2 pillows at home, the pressure difference may be telling. The pressure difference may be the one that's kind of affecting their sleep, as the pressure that was tested or titrated in the sleep lab may be different from what they require at home. Or if, for example, if they drink alcohol frequently, and they didn't do so during the sleep study, that may also change the amount of pressure they require. So all of these things need to be considered. But let's talk about some of the other common issues that we come across. One is the mask. The other one is humidity, claustrophobia. Let me get this spelling right. Claustrophobia and awakenings. Now, these are some of the things that you need to kind of ask the patient to go through to figure out a troubleshoot problems that they have. So let's start with the mask first. So first of all is the mask issue can be dealt with. The patient doesn't love the mask, doesn't like the mask, it doesn't fit well. Go to the DME company. These are the people that provide you the equipment. At their offices itself, if you can find time or you can have transportation over there, this might help give you the most wide selection of masks so that you can try on and decide which ones you're going to go home with. Checking online as well may help. If you have the ability to check online and look for different kinds of masks, that's a great way to identify masks and let the DME company, that's the kind of mask you want if it's covered by insurance. The next option is something called a PAP nap. Now that should be covered by some insurances as well. This is where you go to the sleep lab and they will try different masks on you, and depending on which ones you identify as workable, you can actually lay down in the sleep lab in a bed with the CPAP started on basing your CPAP pressure at home, and basically try to take dry runs of what the mask is going to feel like at home. The next option is humidity. So humidity is a problem that can be dealt with pretty easily. Patients should have access to the humidifier settings, and you can choose to increase the level or decrease the level. I talk about that more under the section how to address mouth dryness with CPAP, so look that up. The next issue is claustrophobia. Now, claustrophobia may be something that you want to decide or deal with before starting them on CPAP. So this is where the education part comes in. If you know someone's extremely sensitive to anything on their face or even having a mask and so on, you may want to avoid CPAP at the get-go and try to explain to them that CPAP may not be the way to go, or you may want to try smaller masks such as the nasal pillow and so on. But again, you can refer to the section desensitization to the CPAP mask and also the section claustrophobia and CPAP for ways to kind of overcome this problem. The next thing is multiple awakenings. Now, it's more difficult when the patient can't actually pinpoint the reason why they awaken, except that they do awaken from time to time and they have no reason why, and sometimes it's actually more than what they had prior to starting CPAP. So one of the most common things to do is check whether they are mouth breathers. If they are mouth breathers and they're on even a nasal mask, and some patients even with a full face mask, the chin may drop down, causing them to have an air leak, which wakes them up. So a chin strap in patients like this may be the way to go, especially if you can check the compliance report and assess the level of the leak. The next thing is an air leak itself. Now, an air leak may awaken the patient due to the high-pitched sound, and that could be due to the mask fit itself. So going back to trying to get a better mask fit may be the option. Facial hair can also cause your mask to slip and slide a little bit more, causing air leaks to occur more frequently. And as the mask gets older, the adherence of the lining to the face as well will change. Hence, the fit won't be as good as when the patient first gets it. So the patient will say everything worked well for the first couple of months, and now I'm noticing that the leaks may be an option, maybe an issue, and even their partners as well assess that the leaks occur more frequently. Again, if you have an issue with that, you can check my section on how to address mask leak with CPAP. The next thing is to check the compliance report. Now, the sleep study report, where you want to check the amount of periodic limb movements, because you don't normally would want to start off treating the periodic limb movement, and this is something that may occur without the patient noticing. However, if they are using CPAP and they find that they're still waking up multiple times or have unrefreshing sleep, looking to see whether the PLMS index is above 15, and at that point you may require treatment as well. So consider checking out the section how to treat PLMS. The next option is to see whether the patient says when they turn over from side to side, the pillow of the mask, the pillow may nudge the mask, causing them to wake up. You can use a CPAP pillow as well, or you can just find a smaller mask to use for these patients. The next common problem is inadequate pressure. So they feel like they're short of breath at certain parts during the night. And this kind of mimics what sleep apnea is like, even despite having CPAP on. You may want to find out from their bed partners if they've started snoring recently, so that may indicate that the CPAP pressure they were titrated on was not adequate. Another way is to check the compliance report and see whether the AHI is above 5. That may indicate that they're not being adequately treated, hence they wake up feeling short of breath. This could be due to use of alcohol, new sedative medications, weight gain. Many years have passed since their last sleep study, hence, due to aging process itself, that may cause a worsening of the sleep apnea problem. So if they have a CPAP machine, at this point a repeat sleep study to see what sort of CPAP they require now, or even they can be changed to an AutoPAP machine, which may account for this increases in pressure. The other thing is with the advent of these settings called EPR, or expiratory pressure release, it drops the pressure as you expire. Now, the drop in pressure may also not be as sensitive and may keep the pressure lower than needed, and the patient may then encounter an episode of obstructive apnea because of this slight drop in pressure during expiration. On the flip side, you have patients who complain of too much pressure, and at this may be due to various factors. One of it may be being weight loss, so a drop in weight over time may cause the CPAP settings to be too high for the patient. The other thing is to confirm where the CPAP settings are as the settings that were indicated during the sleep study. It may be human error putting it in or keying the data in at that point into the machine, and that may cause the pressure to be too high. Sometimes patients may actually require you to apply EPR or C-flex because they feel as they expire, the pressure or the CPAP itself may be overwhelming. Another thing that may cause too much pressure is if the CPAP is above 15, or if you check your AutoPAP machine and you find that the pressure settings are above 15 or at 15, this could indicate the patient may not be tolerating the higher pressures and they may be overwhelming. At this point, transitioning to bi-level or titrating them with bi-level, or what's known as BiPAP, may be helpful. So those are some of the most common issues. Now, if the patient still does not tolerate any of that, and you've tried to troubleshoot all of that, other options such as mandibular advancement devices, lateral positional therapy, surgery, weight loss, hypoglossal nerve stimulators, and the like may need to be considered. All right, so we spoke about today how to troubleshoot the intolerance to CPAP. Thank you.